the first risk factor is being a male.
Yeah.
Being a male who has testicles, because if a boy is castrated at puberty, he can never develop any prostate disease.
At what age should we start getting bothered or concerned about prostate cancer in a man?
Okay, so I think this is important because the peak age that we find men with prostate cancer is between 60 to 70 years of age. Prostate cancer is generally a disease of age. The older the man, the higher the chance of prostate cancer. However, in Black men, we begin to screen and look for prostate cancer from the age of 45. This is because we have some genetic predisposition to prostate cancer. There are certain mutations that occur more commonly in the Black race in genes that, like the what we call the BRCA1 and BRCA2 gene, the RBC gene. These mutations occur more commonly in Black men. So usually from the age of 45, we begin to screen Black men for prostate cancer. But as I mentioned, the peak age that we find prostate cancer is somewhere between 60 to 70 years of age. This has been shown in numerous studies, including my own study. For my dissertation, I did studies for both of the colleges on prostate cancer. So we found, that the peak age is between 60 to 70 years of age. So usually why is important is that when a man that is 35 years old presents to you with some issues like difficulty with passing urine or blood in urine, prostate cancer doesn't come first in your differentials for your diagnosis. I mean, that would be very strange. But if such a patient is 60, 61 years old, he cannot pass urine or something, or there's blood in urine, low back pain, prostate cancer will definitely be number one. Is allowable if you fail, if your diagnosis is not correct eventually, and you find out it's something else, than to be thinking of something more benign and it ends up being something cancerous like prostate cancer, which you could have picked with the index of suspicion early enough, and you may have been able to save that life. So that is as regards the age. Something else to mention is that the longer a man lives, the higher the chances that he may have prostate cancer in his life. As my boss will say, if you check 100 men, if you pick 100 men who are 80 years old, about 80% of them are likely to have prostate cancer. You pick 100 men who are 90 years old, about 90% of them are likely to have prostate cancer. If you pick 100 men who are 100 years old, all of them are likely to have some form of cancer in their prostate. But this does not now mean that is likely to be what is going to kill them. It can exist with the patient without actually being, sinister to the patient. The older a patient is when we make the diagnosis, the less worried we are and the less aggressive we are with the treatment.
Quickly, without wasting time, I'm going further again. Let's discuss those factors that could make a man come down. You've spoken about age, so let's try to talk about the area of family history. If a young man has a father or maybe a brother with prostate cancer, are there chances that he could come down with prostate cancer? What are those other factors that could make a man predisposed to prostate cancer?
So you said it perfectly. Age, number one, the older the man. Then two, we talked about genetics. So there's something we call a familial prostate cancer. So usually, if an individual has, prostate cancer occurring in 3 generations, grandfather, father, and then in their own. So we talk about a familial prostate cancer. If an individual has had a relative having diagnosed of prostate cancer less than 55 years old, that individual is likely, we're dealing with what we call a familial prostate cancer. I hope you understand what I mean. So what this means is that when somebody gives you such a history, you have to be a lot more aggressive in them, because familial prostate cancer occurs earlier at younger age. Those are the ones you can see as 40, 42 years of age. They are usually a lot more aggressive. What we call the Gleason score is usually a lot higher. So it spreads a lot faster and much more difficult to treat. And then mortality rates and survival is usually worse in this kind of patients. So when a man comes with this kind of history and you find out that his dad or grandfather or brother or somebody had that kind of disease, you must be worried. If you find out that somebody in his family or something contracted disease at an age younger than 55 years old, you should get worried. All right, so this is about familial prostate cancer. Other things will include things like obesity. Okay, it's said that obesity causes some hormonal imbalance because adipose tissues produce lots of estrogen, which is not the male hormone. So there's really a hormone imbalance, which is also one of the factors that has been said to be a predisposing factor to prostate cancer. Okay, great. All right, it said that deficiency of certain trace elements, things like zinc, selenium in diet, raise the incidence of prostate cancer. Many studies have been done to this effect, including studies that I've performed myself, and they have been found to a large extent to be true. Okay, we've talked about diet. That diet that is rich in fatty food and industrialized food can increase the risk of prostate cancer. Smoking has been found to be a risk factor for prostate cancer, just like every other cancer, 100 cancers, all of them. Smoking, if you say smoking, you are not wrong. They talk about the history of we're going from more established risk factors to less established risk factors. Then some other risk factors are things like sexually transmitted infections. Some recent studies are showing that variants of herpes virus and viruses that can cause cancer in cervical cancer and co can cause recurrent inflammation in the prostate that can lead to dysplasia, metaplasia, and then cancer. All right. Okay, good. And then there are also factors related to when the part of the myths that we're about to discuss now, things that are related to stasis. So some researchers have also discussed the fact that patients who ejaculate more often, or individuals who ejaculate more often in the excess of 21 times in a month, have a less chance of developing prostate cancer than those who ejaculate 4 times or less per month. This was a study performed by Ryder et al. So these ones are things that are actually still under research and under review. So these are some of the risk factors. But as my boss will teach, will say, the first risk factor is being a male.
Yeah.
Being a male who has testicles, because if a boy is castrated at puberty, he can never develop any prostate disease, prostate cancer, or any kind of prostate enlargement. So it must be established that for a man to have the risk for prostate cancer or prostate disease, he must be a man who has his testicles intact and has normal hormone levels of testosterone in his body. Then these are things that can now occur or that we'll have to look out for. Thank you.
Thank you